Bismillahirrahmanirrahim. Welcome back, friends. Welcome back to another video lecture by Kami microbiologist. So dear viewers, today in this video lecture we are going to see another chemistry or clinical chemistry test that is related to the lipid profile, and in this video we are going to see the high density lipoprotein test. We also called it HDL test. So my name is Muhammad Kamil Khan and you guys watching my channel Kami microbiologist. So let's start the video. Dear viewers, in this video lecture we are going to see first of all that what is HDL, then we will explain HDL test, then we will see the function of HDL, then we will see that why HDL test is important, why the doctor recommend this test, or we can say the purpose of the test. Then we are going to see the test procedure and requirements. Then we will explain the normal range of the test of HDL. Then we are going to see the main causes of high and low HDL, and then finally we will explain the treatment, that if let's suppose HDL level is high or low, what is the treatment. Okay, so these are the main content that we are going to explain. So first of all, let's see the introduction. So HDL, the full form of HDL is a high density lipoprotein. Okay, HDL is also called good cholesterol, and HDL is also called HDLC, means high density lipoprotein cholesterol. HDL is mostly synthesized, or we can say it is produced from the liver as well as from the intestine. Moreover, if we talked about the HDL test, that what is HDL test, so it's very simple. The test that can measure the level or the quantity of the HDL into the bloodstream, we simply called it HDL test. Now let's see the function of HDL. If let's suppose it is present in our body, what is the importance of this HDL in our body? Remember, the HDL can reduce the risk of coronary diseases, or we can say coronary artery disease or heart disease. Okay, why? Because HDL can protect us from a disease which we called it atherosclerosis. It is a kind of disease in which the cholesterol, or we can say bad cholesterol, or the fatty acid, or the lipids or the fats are deposited into the arteries, due to which the arteries the way of for the blood flow is very we can say is very low, due to which it can increase the blood pressure, each and everything. Okay, so due to high HDL, it can protect the atherosclerosis and coronary heart disease, or we can say artery diseases. Moreover, the HDL can also remove the bad cholesterol. Now how? If let's suppose the bad cholesterol is present in our body, bad cholesterol means LDL, we will explain it in inshallah in other videos lecture. So if let's suppose the bad cholesterol is present, so it will cause coronary disease as well as atherosclerosis. So due to the presence of HDL, means good cholesterol, what will happen? It will transport the bad cholesterol back to the liver. Okay, so once it is transferred to the liver, so inside the liver the bad cholesterol will be metabolized, metabolism will occur, and due to this way it will be shift to the stomach, means in the form of the biles, and then it will remove from the body. Okay, so this is how it can remove, and it is all about this good cholesterol, or we can say HDL. Another function of HDL is that it have anti-inflammatory effect as well as antioxidant effect. If there is inflammation into the heart, or we can say in the arteries, so the HDL will solve this issue. Moreover, HDL can also improve the heart health as well. Okay, so this is the function of HDL. Now let's see the main purpose or the diagnostic purpose, or why the doctor recommend this test, what is the importance of this test. Now when we perform that test, so we will make sure the heart disease risk. So this test can tell us the heart disease risk of the heart disease. This test can also help to evaluate overall lipid profile. This test can also tell us the treatment effect that we are providing for the heart diseases, or for the cholesterol or triglyceride level. Okay, so these are the main purpose that why this test is recommended. Now let's see the requirements. So whenever you are performing this test, so you need a blood in gel tube, red top, or we can say heparin tube, we also call it green top. Okay, you need a yellow tip, blue tip, dry incubator, and centrifuge. Okay, now from the heparin tube you will get plasma, from the gel and red top you will get serum. So the test will be performed from the plasma as well as from the serum. This is the yellow tip, this is the blue tip through which we can take the reagents, and this is the yellow tip through which we can take the serum or plasma and we'll mix it. We also need calcium tube, I forgot mention here. Okay, so we need a calcium tube as well. So this is the dry incubator. Dry incubator is important because it will provide the incubation at 37 degrees Celsius. A centrifuge will be important because it can centrifuge the blood to separate the serum and plasma. We need advanced machine like Selectra, and we need semi-automated machine like a chemistry analyzer machine, as we can say like MicroLab 300 machine. Remember guys, the test can be run with this machine, that is the advanced, and with this machine, that is the semi-automated machine, or we can say these two are the chemistry analyzer machine. Okay, so you can run the test with this machine. Let's see the test procedure, that how to perform that test. First of all, you need the blood in gel tube, red top or green top, as we discussed. Then you will centrifuge the blood to get the serum, or it will separate the serum or plasma. Then you will run it if you have advanced machine like Selectra. Okay, let's suppose if you don't have the advanced machine like Selectra, then what will you do? You will have the kit of HDL. So in this we have different type of the kits, and the kits have different procedure. So in this case we are using aniline kit. So then you take R1 800 microliter, R2 you need 200 microliter. But the process is that first of all you need to take 800 microliter R1, you will mix it with 10 microliter of the serum, and then you will incubate it for 5 minutes. After 5 minute incubation at 37 degrees Celsius, then you will add 200 microliter reagent 2, and then you will mix it, and again you will incubate it for 5 minutes at 37 degrees Celsius. After that you will run the test on MicroLab 300 machine, or we can say chemistry analyzer, semi-automated chemistry analyzer machine. This is how to perform the test. Remember guys, I already explained the test procedure of triglyceride, cholesterol, and some other test as well. So the test is very simple. If you want to see the practical videos, the practical video will be present into my channel. Okay, I already explained the uric acid test, so the same will be this HDL. Okay, there is no difference, but just the difference is the kit. Now let's see the normal range. So in case we talked about the normal range of the HDL, so in case of male, the normal range will be more than 40 mg per deciliter, microgram per deciliter, and in case of female, the normal range will be more than 50 mg per deciliter. Now remember, if we are talking about that, it should be more than 40 or 50 mg per deciliter, but remember, it should not be more than 90 mg per deciliter. Okay, so this is the normal range. Now let's see, if let's suppose the cholesterol level get low in our body, so what will be the problem we will face? Okay, so the main causes of the low cholesterol is due to the smoking and alcoholism. Now if the cholesterol level get low in our body, so it will cause coronary disease. If it is low in our body, then it will cause renal failure, or we can say nephrotic syndrome. I forget to write here, but it will also cause nephrotic syndrome. Due to obesity and stress, the cholesterol level will also low, or we can say low cholesterol will cause obesity and stress. Low cholesterol will also cause cholecystitis and diabetes mellitus disease. Low cholesterol is due to the nephrotic and metabolic syndrome. So low HDL can also cause if you are if you are not performing any exercise, so it will also cause the low HDL. So remember, if we are using certain diets, so in diet like if we are using carbohydrate and fat, so it will also reduce the HDL level. And if let's suppose we are using some type of the medicine like beta blockers, anabolic stains, like if we are using some other drugs like antipsychotic drugs, so it will also reduce the HDL level in the blood. Moreover, due to low HDL, it will cause inflammation and hypothyroidism. Hypothyroidism means low level of hormone, and low HDL is also due to the familial, means it will be also the genetic disease as well. So this is the main causes of the low HDL. Now let's see the main causes of the high HDL. So high HDL is caused by metabolic syndrome, weight loss, exercise, certain medication, stains, fibroids, vitamin B3, corticosteroid or estrogen. Okay, this HDL will be the HDL level will be also high if there is it is also a genetic disease, we can say like that. Due to alcoholism, due to a hormonal disease, the HDL level will get high. Okay, now if you are using diet like healthy fats, omega-3 and fatty acid, it will also increase the HDL level. Remember guys, HDL level when it is high, so there will be no risk. A little bit risk is hormonal disorder, okay, but there is no risk of the high HDL. High HDL will give you benefit, okay, remember. Now then we have the treatment of low and high HDL. If let's suppose your HDL level get low in your body, so you may have performed daily exercise, you have to stop alcohol and smoking, you have to lose your weight, you have to take good diets like olive oil, means you have to use olive oil in your food, high fibers, fruits and fatty fishes. Then there are some certain medication that will improve your HDL, like we have niacin and statins. Then if you are control your diabetes disease, so it will also improve your HDL level. So this is all about the HDL test. I hope you understand. Thank you so much for watching. If you like this video, make sure to hit the like button, share this video and definitely subscribe the channel to get more interesting videos like that. Thank you so much for watching.